Hello, my name is Pauline RN. Welcome to my channel. The title of my video today is Oxygenation, questions and answers from RN Nclex examination. I have part 1 and part 2. Please hit the like button, please subscribe, please share this video. My first question, how do you auscultate the lungs? The correct answer, you compare the right side to the left side. My next question is, what will be your interventions for patients with wheezing? What will be your assessments and interventions for patients with wheezing? Correct answer, you'll assess the lungs for high-pitched whistling sound. Treatment for wheezing, the doctor will order albuterol inhalers, bronchodilators for treatment of wheezing is the correct answer. Please note, wheezing is seen in patients with COPD and asthma. Make sure they're in an orthopneic position. Make sure they're using their incentive spirometers. Encourage hydration, oral hydration, and teach these patients to quit smoking. My next question, patients with COPD and asthma, what will be our interventions and teaching for these patients? Correct answer, we'll teach them to breathe with pursed lips as if blowing out a candle. We will teach them diaphragmatic breathing. We'll teach them breathing in a brown paper bag to assist lung expansion. We'll teach them to breathe in an upright position, the orthopneic position. Next question, what are your cough medications? They are your Robitussin, your Tessalon pearls, your throat lozenges. Next question, when do you use humidified oxygen? Correct answer, we'll use humidified oxygen when the doctor has ordered 5 or more liters of oxygen nasal cannula. It prevents drying of the nostrils and throat. We should always assess our patients' nostrils for skin breakdown with nasal cannulas. We use sterile water in a bottle attached to the wall. For a non-rebreather mask, we never ever use humidified oxygen. For a non-rebreather mask, it's 10 to 15 liters of oxygen administered. We do not use humidified or sterile water with non-rebreather mask. We use humidified oxygen, nasal cannula, 5 or greater liters of oxygen. Okay, what will be our assessment for decreased oxygenation of your patient? Your patient's on the monitor, the oxygen is low. What will be your assessment? First, you check the flow meter on the wall. Check to see if it's on. Check to see if it's turned on or off. Check the flow meter first. Make sure on the flow meter you have the correct setting on the flow meter. If the oxygen on the wall is fine, you check the patient's finger, the pulse ox. Make sure the pulse ox is tightly fitted to the patient's finger, enough to promote proper circulation. Some elderly patients, their fingers are really cold, their fingers and toes. You have to warm them up with water. Check to see if your patients have nail polish. Nail polish can interfere with the reading of your pulse ox. Some patients, if their fingers are cold, you'll have to try applying the pulse ox maybe to their foreheads or their toes or their ears. Next question, how do we improve oxygenation of our patients? Correct answer, we turn them every 2 hours for the patients who are bedridden. Patients who are able to get up in the chair, we get them up in a chair. Post-operative patient, instruction, activities as tolerated, doctor's orders, okay to get them up, we get them up to a chair. We ambulate our patients. This is a way to improve oxygenation in our patients. We encourage them to use their incentive spirometers if ordered by the doctors at the bedside. What will be our respiratory assessments? The correct answer, heart rate. You check the heart rate, symmetry, depth, sound, auscultation of breathing, observance of accessory muscles, assess trachea, deviation is the correct answer for respiratory assessment. Next question, where is the apex of the lungs located? Laterally 2 cm superior to medial 1/3 of the clavicle is the location of the apex of the lungs. What is cyanosis? Answer is blueness. Oxygen is low. Assess your patients for confusion. First sign of low oxygen. Next question, what is bradyapnea? And bradyapnea is less than 12 beats per minute. Ventilation. What is ventilation? Ventilation is the process of moving gases in and out of the lungs. What is tachypnea? Tachypnea is breathing greater than 20 breaths per minute. Next question, what's Kussmaul respiration? The correct answer is a type of hyperventilation, labored breathing, deep breathing, acidosis. This is an emergency. Notify your doctor for Kussmaul respirations. Next question, what is Shine strokes? Shine strokes respiration seen in dying patients, hospice patients, pattern fast, shallow, slow, periods of apnea, heavy breathing. Notify the doctor. Next question, when we're performing CPA, what should we note? Correct answer is CAB. It's circulation first, then airway, then breathing. CAB to perform CPR. Next question, what is the Heimlich maneuver? This is an abdominal thrust for patients who are breathing cardinal sign, they will hold their throats. No air is getting through. Next question, how do we do mouth care for the unconscious patients? The correct position is sideline, prevents obstruction of the airway, prevents tongue obstruction. Elevate the head. Like, share, and subscribe. Thanks for listening. This ends part 1 of oxygenation. Stay tuned to part 2. Thank you. Have a blessed day.